basically we also have spaces of hand, which also comes as like it can come as an essay question, or it can come as like short note also. So now when you just look at the palm, basically in the palm we have two spaces. So what is this eminence, what you see towards the thumb? You call it as thenar eminence, and towards the little finger we call it as hypothenar eminence. Okay, and we know towards the little finger we have medial side of our body, and away from the little finger, that is towards the thumb, that is lateral side of the body. Okay, so that means this empty space is actually close to the midline. That's why it is called as mid palmar space, and this is called as thenar space. Okay, so in order to understand this picture, you need to remember the names of muscles what we have in the forearm. Almost I'm telling you the names regularly, if you can remember. Okay, see here, beta. Don't read anything here. Just try to observe this picture. Okay, so in this picture, what we are finding, Niharika, meanwhile, in Chaurasia textbook for mid-palmar and thenar space, one table is given, beta. You be ready with that picture. I'll ask you to share. Okay, once you understand that, you can write
Yes,
it from the table. Okay, now see here. Now
yes,
this letter, actually this looks like Telugu letter A, something like that. So we have, see, this is the right thing what we has, like right hand which has been shown. This is thenar eminence. We have thenar muscles. Do you remember the name? I told you the code AFO. Abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and we also have adductor. So these are the thenar muscles here. Towards the little finger, we have same AFO code, but the muscles are abductor digitae minimi, flexor digitae minimi, opponens digitae minimi. So when you start doing dissection of the hand, see, I'll try to show you a different picture, but maybe you will not get the orientation from these pictures. Palmar. Okay, just a minute. We will also try to share internet pictures for the dissection of palm so that you will get an idea. These pictures will definitely help you to understand better. Now see here. Now first of all, when we are doing the dissection, you should imagine as though you're, otherwise you will not understand what we are studying as spaces. So first thing when you encounter, you do the dissection, first thing we will see the skin. Okay, we are reflecting the skin. Once you reflect the skin, you will see there is a triangular expansion which is called as Palmar Aponeurosis. Okay, Palmar Aponeurosis is also very, very important, beta. It's like one of the muscles we see in the forearm is palmaris longus. The same palmaris longus muscle is actually forming a triangular expansion which we see just below the palm. You call it as Palmar Aponeurosis. So Palmar Aponeurosis, apex is towards Flexor Retinaculum and base is splitting into 4 slips. Each slip further splits into 2 slips which will be actually getting inserted into this point. This point is, what is the name? Metacarpophalangeal joint. Okay, this is thumb thenar eminence and this is hypothenar eminence. And the function of Palmar aponeurosis is it increases the grip. Second function is it gives the origin to the muscles of thenar and hypothenar group of muscles. Okay. Now, suppose if this is getting infected and if the palm is little deviated, you call that condition as Dupuytren's contracture. Okay. So once you see like you have reflected the skin, so you have removed the palmar aponeurosis, what you will see in the palm is you are finding towards the thumb we are finding thenar muscles, towards the little finger we are finding hypothenar muscles. This is our flexor retinaculum. We are finding the long flexor tendons of the forearm are entering into the palm. So between the long flexor tendons, if you find we have small earthworm like muscles, these are actually lumbricals, lumbrical muscles. Stepwise I am showing you. Okay. First you saw the skin, second you saw palmar aponeurosis, third you are finding the long flexor tendons like flexor digitorum superficialis, flexor digitorum profundus. Between the tendons of flexor digitorum profundus we are finding lumbricals. Below lumbricals we will find the interossei, what we saw yesterday, the palmar and dorsal interossei. Okay. So like that you have so many things in the palm. Okay. So in between these structures you will find some empty spaces. Those empty spaces are nothing but thenar and hypo, like mid palmar and thenar spaces. Okay. Now this is one more picture which you can see. This is our flexor retinaculum, below which all long flexor tendons are passing, and between the muscles you will see the empty spaces which are nothing but spaces of palm. Okay. Some idea you should have got. So like that in the middle of the palm we have mid palmar space, and towards the thumb we have the thenar space. Okay. So between the muscles, now if you see this picture, this is actually whole palm, and if you can understand this picture you will understand everything. I'll try to make you understand so that concept becomes clear. See here, when you are trying to do dissection, first thing you come across is skin. Below that you will see the superficial fascia. Then we have palmar aponeurosis. Palmar aponeurosis. Then you are finding these tendons. What are these? Flexor digitorum superficialis. Below this we have flexor digitorum profundus. Between the flexor digitorum profundus we have lumbricals. Okay. And deeper inside this green area is an empty space. This is towards the little finger, hence you call it as mid palmar space. There is one more green empty area which is towards the thumb, which you call it as thenar space. Thenar space. Now these are metacarpal bones, what we studied yesterday. Between the metacarpal bones, what are the bone muscles we see? From the palmar aspect, we call them as palmar interossei. From the dorsal aspect, we call it as dorsal. Dorsal aspect is this, dorsal interossei, and this is the skin of the dorsum of the hand, below which this yellow area is subcutaneous tissue. Subcutaneous tissue. Okay. And these are thenar group of muscles towards the thumb, and these are hypothenar group of the muscles which are towards the little finger. Okay. So that is one thing which we should know, and different pictures are shown to make you understand like how we have towards the little finger the empty space blue in color is shown, that is the mid palmar space, and towards the thumb some blue color small area is shown between the muscles. This empty space is nothing but the thenar space. I tried my best to make you understand better. Now let us see, I will go back to our PowerPoint. So simple things like which are easy and which you can easily present in your exam, I'll tell so that you will write if this question comes. Basically, the spaces of, you need not remember all these, but I'll tell you what to remember. Spaces of hand are of clinical significance because these empty spaces are the spaces where infection can occur and it may be distended with pus. Okay. So in the palm we have mid palmar space, thenar space. This pulp space of finger, it also can come as 5 marks or 3 marks question. Only these three are important, beta. Rest are only for namesake. You need not worry. Okay. Now, so mid palmar space. Now when you talk about mid palmar space, this is towards the little finger, right? Okay, this is thumb. This is not towards thumb. This is towards the little finger. So this pinkish area, whatever you are finding, this is actually the complete space. Towards the little finger, it is called as the mid palmar space, and towards the thumb, it is called as thenar space. Okay, so in the mid palmar space, in front, what do we see? I said this is the green line you are finding with us. This is in front. Try to understand this picture. Below skin, what do we find? Aponeurosis, Palmar aponeurosis. Okay, below this, we are going to discuss today this arch. That is the superficial palmar arch. Okay, then we have flexor tendons of little finger, ring finger, and middle finger. These are. This is because this is the little finger, middle finger, and ring finger. These are the flexor tendons. Okay, then we also find the synovial sheaths around them, and we will also see third and fourth lumbrical. Third and fourth lumbrical is also seen over this point. Okay, lumbricals, these are this is third lumbrical and this is the fourth lumbrical you are finding, which you are seeing between the tendons of flexor digitorum profundus. Okay, these are the boundaries. This is our space. These are the boundaries in front. Is that clear? We are talking about this space and these are the boundaries. Now, so mid palmar space behind, that means when you behind, try to see from here only better. See, this is in front, no? So what are these muscles I told you? Between the metacarpal bones, what are the muscles we have? Palmar interossei and dorsal interossei. This is subaponeurotic space and this is the dorsum of the hind, like skin of the dorsum of the hind. So behind you will see dense fascia which is covering the interosseous muscles and the metacarpal bones of third and fourth space. This picture only is better. Okay, this is third space and this is fourth space. We are finding the interossea and thick fascia covering it will form the posterior boundary, behind boundary. Now, coming to the lateral, now this is our space, right? So this becomes the lateral boundary. Towards the thumb is lateral and towards the little finger is medial. So towards lateral side, you have a partition septum, which is like dotted line, which is shown here. You call it as intermediate fibrous septum. This is intermediate fibrous septum. Okay, then medially, this is the medial thing. What medially, what are we finding? We are finding hypothenar muscles. Hypothenar muscles. Okay, four boundaries we saw. Now, see, this is our mid palmar space and this is the proximal boundary. This we studied yesterday. What is that proximally we have? Flexor retinaculum. Flexor, only one word you remember, flexor retinaculum. And distally, see, this is our mid palmar space and this is the distal extension. So distally, it is just going like an finger-like projections which are called as diverticulae. Okay, then so suppose the what is the significance of these spaces? These spaces are important because there may be infection. These empty spaces become potential areas for infection. If there is any bacteria which is entering inside, it will cause the formation of pus and a painful condition like this. Okay, so that's the reason the normal concavity of our palm will be last and there will be tenderness in the central area of the palm. Okay, there may be pain along with the movements of third and fourth digit if it is the infection of mid palmar space. Okay, now treatment. So this is the position of our mid palmar space, right? So we need to give an incision at the area of C or at the interdigital clefts of third and fourth digits. Okay, these orange lines are indicating the plane along which we can give a nick incision and we can express the pus, and that's how the wound healing takes place. Okay, so pus is usually drained by splitting the web spaces between third and fourth. These are the digits. And this is the lumbrical canal. Okay. I hope that is clear. Mid palmar space, Niharika.
Yes, ma'am.
Okay. Now, similarly, towards the thumb also there is one empty space which is called as thenar space. Okay. So this thenar space is like a triangle. Okay, triangle. Now see here better, don't read anything. If you practice this diagram, you will write in your own words. Now let us see how to. Now this space towards the thumb is the thenar space. So these all structures, whatever you see here, they form in front boundaries. So same like the previous one. This mid-palmar septum is the line of partition. Towards medial side, we have mid-palmar space. Towards lateral side, we have thenar space, right? So now see here in front, this area, what are the things we have? Palmar aponeurosis, isn't it? Then below that, we will have superficial palmar arch. This is muscles of thenar eminence. Then these are the tendons of the index finger, and this is first and second lumbrical. First and second lumbrical you are finding in this as anterior boundary of thenar space. This is the anterior boundary. Then what is the posterior boundary? Posterior boundary you are finding the metacarpal bones. Between the metacarpal bones, especially which one? Second and third metacarpal bones, and in between them we will have palmar and dorsal interossei. Okay, then so behind we are also finding one muscle, that is adductor pollicis, thenar group. This one better. The name of this muscle what you are finding is adductor pollicis. Okay, so these are the two boundaries. Now see here, which is now this is our, this is close to the midline, this is away from the midline. So laterally we are finding, see this is the lateral margin of this space. So laterally you are finding the tendon of flexor pollicis longus, this one laterally. This is our space, right? And this is the lateral boundary, this is the medial boundary. This is our space. So laterally we have flexor pollicis longus, okay? And medially this is the septum, intermediate fibrous septum. This was the septum which was making medial bound, lateral boundary for mid-palmar space, but it is forming medial boundary for thenar space. This is in midline. For this space, this is lateral. For this space, this is medial, because this is our little finger, this is our thumb. Okay. Then now coming to the proximal, same thing. This is our thenar space. Proximally, we have flexor retinaculum. Distally, these are the diverticulae 1 and 2. Okay, along the first and second lumbrical tendons. Okay, beta. So these are the boundaries of mid-palmar and thenar spaces. As mid-palmar space can get infected, similarly, the thenar space also can get infected. So the infection may reach via radial bursa. Okay. So pain and swelling may be there. So in the first web space, thumb is held in abducted and flexed position. Okay, like this. Then you have to guess it is a infection of the thenar space. So what to give? Then incision we have to give like this, trained by an incision in the first web space. Okay. So that is all about mid-palmar and thenar space. Niharika, if you are ready with the, please can you share beta if you are ready? You can just learn the table which is given in Chaurasia. Thank you so much. Yes, beta. This beautiful table will help you to write, and this beautiful picture you can draw. This is thenar and this is hypothenar. Okay, this is skin, superficial fascia, palmar aponeurosis, superficial palmar arch. Okay, this is little finger, hence this is mid palmar space. This is thumb, hence it is mid palmar, which space better? Like thenar space. Thenar and mid palmar space. This is the intermediate septum. Whatever space you are finding here is the mid palmar and thenar. Please share this photograph better in our group, so that if students who do not have this book will be benefited. Okay, now you can stop sharing. Thank you so much. Thank you, better. Now there is one more very important topic that is called as pulp space. Now see here in the fingers, this is also 3 marks or 5 marks question. Very important question, beta. Now from the skin to the bone, this is our bone. Proximal phalanx, middle phalanx, distal phalanx. We have 3 phalanges, no? Now we are only talking about distal phalanx, last phalanx. So from the skin to the distal phalangeal bone, you are finding fibrous septae are extending. Fibrous septae. So between the fibrous septae, lot of fat and tight fat will be present. Okay, and it will be so tight, like if there is any infection, the pus will not be able to expand, and there will be severe pain if there is any infection in the pulp space. And that infection is called as Whitlow. I'll give you the spelling now. So this is very important. But a pulp space is also a very popular question. We have space between the palmar skin and distal phalanges. of all the fingers. Okay, it lies distal to the fibrous sheaths of the flexor tendons. Skin is connected to the periosteum of distal phalanx by numerous radiating fibrous septa. This one, and they contain tight compartments which contains lot of fat and also blood vessels. Okay, so like that lot of fat is shown. This is Netter's atlas picture. This is our skin. This is the bone. In between we have the fibrous septae and lot of fat in between. No free space to expand. That is the reason. If there is any infection, you call that condition as Whitlow. Infection of pulp space is very common and of course very painful. It may occur in the thumb and also in the index finger. Okay, now if we are doing any pinprick or when we bite the nail or something like that, there is basically this risk. So it's also called as Whitlow. Another word which is used is felon. For our in our question banks and in our previous papers, Whitlow word is usually used. Question comes like Whitlow. That is nothing but infection of pulp space of the finger. Okay. Then you will see like there will be severe pain and avascular necrosis. Okay. No, these are not required, but I don't want to unnecessarily. Like actually, in just below the dorsum of the skin, also we have a space which can get infected. Okay, in the forearm also we have empty space. You call it as forearm space of Parona. There also infections can happen. Okay, so around the tendons, basically we have bursae. Like bursae, usually we see around the joints, no, wherever friction is more. Similarly, long flexor tendons like flexor carpi radialis, flexor carpi ulnaris, when they enter from the forearm to the palm, they generally have a covering of the synovial sheath. Okay, so that is actually called as bursae. Okay, then you see here, these are the bursae, like radial bursa is towards the thumb beta. Okay, flexor pollicis longus will have this covering. Okay, ulnar bursa is this infection, ulnar bursa. So we have synovial sheaths around the long flexor tendons. You need not know all this. I'm just giving you an information. But there is one topic which is called as vincula, vincula longa, vincula brevia. That question may come better. So what is that vincula? I'll tell you. See here, this is long flexor tendon. Both are coming from the forearm. Like flexor digitorum superficialis, which gets inserted in the middle phalanx. It splits into two and gets inserted into middle phalanx. See, this is proximal phalanx. This is middle phalanx and this is distal phalanx. Okay, sorry, proximal, middle and distal. So proximal phalanx, middle phalanx and distal phalanx. Now, flexor digitorum superficialis is getting attached to middle phalanx and flexor digitorum profundus is getting inserted into the base of the distal phalanx. Now, if you lift these tendons, like you have peritoneal covering for like abdominal visceral organs, if you remember, meso ovarium, meso appendix, I said, isn't it? Mesometrium. Meso word we usually use to relate if there is any peritoneal covering. Similarly, these long flexor tendons will have some synovial coverings which are attaching to bone. So these connections are actually called as vincula. Vincula. Vinculum is singular, vincula is plural. So if they are long in size, you call them as vincula longa. If they are short in size, we call it as vincula brevia. Vincula brevia. Okay. Now coming to our topic which you asked me yesterday, that is arterial arches of palm. So in the forearm we have discussed like we have two blood vessels, right? What are the two blood vessels we saw? We saw superficial like radial artery which was seen on the lateral side, ulnar artery which was seen on the medial side. These are the thenar muscles towards the thumb. These are the hypothenar muscles. So the radial artery and ulnar artery, they branch just below the skin superficial fascia, Palmar Aponeurosis, and we have one arch which is formed deep above the bones, metacarpal bones. So the plane of formation of these arches is different. One is with like superficially situated and the other is deeply situated. So correspondingly, they are named as superficial palmar arch and deep palmar arch. Okay. So terminal part of radial and ulnar arteries in the palm, they anastomose with each other to form this distal one is actually superficial palmar arch and proximal one is deep palmar arch. Okay. Proximal is near to the body and distal is away from the body. Beta. Okay. Now let us talk about superficial palmar arch. So superficial palmar arch. Now see here. This is flexor retinaculum. This is our ulnar artery. So accompanied by ulnar nerve. Both are side by side. On the medial side enters in the palm. Superficial to the flexor retinaculum. On the radial side of pisiform bone. Here it is entering like this. Okay, then what's happening, let us see. So superficial palmar arch, now see here beta. See, this is flexor retinaculum. We are finding this is our superficial branch of radial artery, which is coming like this, like in the form of dotted line it is shown. And the continuous thing what you are finding is the ulnar artery, and it is forming an arch like this. So this arch is nothing but superficial palmar arch. Okay. No, just you read the theory part. So beneath palmaris brevis, that is a very subcutaneous muscle. You will see we have like this ulnar artery will divide into superficial and deep branches. So superficial branch is the direct continuation. Okay. So here you are finding this is the ulnar artery and this is the superficial branch which is the direct continuation which like anastomosis with the like superficial branch of radial artery. They are anastomosis. Okay. Then this is our superficial palmar arch. So I will give you simple pictures. Don't read anything. It becomes little complicated. If you understand with the help of picture, it becomes very easy for you. Now let us try to understand it like this. Now see, whatever is shown in pink color is superficial palmar arch. Okay, we know like direct continuation of ulnar artery and the superficial palmar branch of radial artery, they are joining to form the superficial palmar arch. Now, what are its branches? Listen carefully. There is one artery which is going on the medial side of the little finger. This is the direct branch. Okay. So, this is palmar artery. Okay. So, we have actually common palmar and proper palmar arteries. Okay. So, common in the sense 1, 2, 3. These are common palmar digital arteries. Common palmar. Why they are called as common? Because they are dividing at the interdigital cleft. See, this artery is dividing into two. This artery is also dividing into two. This artery is also dividing into two. So once they divide, they are called as proper palmar digital arteries. One common will give two proper arteries. One common, two proper. One common, two proper. So CP, like that you remember, CP. Common palmar digital arteries, and these are proper palmar digital arteries. For nerves also, these names are only used. Okay. Now one artery is directly going to the little finger, whereas the three common palmar digital arteries they give overall. When you just see how many digits are supplied by superficial palmar arch, 1, 2, 3, and half. Here color has changed. It is red color. Only 3.5 digits are actually medial 3.5 digits are supplied by superficial palmar arch. Okay. Now this superficial palmar arch sometimes basically it goes and joins with superficial palmar artery, but there may be certain variations like it may sometimes go and join with this artery to complete the arch, that is princeps pollicis, and sometimes it may join this artery which is called as radialis indicis. Instead of joining this artery, variations you can skip also, it may join these arteries, princeps pollicis and radialis indicis. Draw this picture and give your own information, that is also enough. Okay, but like theory will be little complicated language. If you understand, you can write in your own words better. So superficial palmar arch is formed by superficial terminal branch of ulnar artery, and laterally it can be like Palmar branch of radial artery, or sometimes I said variations. Princeps pollicis, radialis indicis. These are variations, not required. Branches are, what are those? Palmar digital arteries, common Palmar, proper Palmar. Look at the picture, you give your own sentences. One, two, three. These are common Palmar. These are proper Palmar digital arteries. Okay. Once you are done with superficial palmar arch, then what are we left with now? This red colored thing. What is that? Deep palmar arch. How is the deep palmar arch formed? Now see here. See, this is the terminal end of the radial artery and deep branch of the ulnar artery. Overall radial ulnar only. In superficial plane, there is one anastomosis. In deep plane, there is one more anastomosis. That's it. Okay, beta. So you are finding you very clearly this is the terminal end of radial artery and deep branch of ulnar artery. They are anastomosing to form deep palmar arch. So what is it supplying? What is left over? 1.5 digits. One complete thumb and half of the index finger is supplied by deep palmar arch. Okay, beta? That's it. So the one which goes to the thumb directly, you call it as pollicis means thumb, princeps pollicis artery, and the one which goes to index finger on the medial lateral side, you call it as what is this? Radialis indicis artery. Radialis indicis artery. Okay. So So many other branches apart from this also it gives. You can just remember the names. 3 Palmar metacarpal arteries, 3 perforating arteries, and recurrent branches also it gives. Okay, so finally this is the superficial Palmar arch which is superficially located, and this is the deep Palmar arch. Okay, so you can just take the picture of this, or if you are screen recording it's fine. Okay, because you have this table is not given in is it given in Vishram Singh? I don't remember, but this is a good table, but like how is it formed? It is written how like location, like it is superficial to long flexor tendons, deep palmar arch is deep to the long flexor tendons, branches 3 common palmar digital arteries, 3 proper metacarpal arteries, 1 proper digital cutaneous branches. Very good table, but a very like crisp like information, everything is given here. You just need to draw one very good diagram and write your own explanation by elaborating this. Anyhow, it will be only for 5 marks. It will not come for essay question for sure. Okay. So that is all about palm beta. So after palm, what are the other questions you asked me? So yesterday's topics are done. Venous and lymphatic drainage of lobulum, intercostal space. Okay. Okay. Vivek, we did lung. You were not there. So I will try to open intercostal space. Intercostal space also can be an essay question, madam. Now see here. So what is intercostal space? Now if you see in the rib cage, like we have how many ribs? 12 pairs of ribs are present on the right side and left side, right? So in between the ribs, if you see, there are empty spaces. So these empty spaces are nothing but intercostal spaces. Okay. So basically when you see the entire thoracic cage, in the midline we have sternum, behind we have vertebral column, and on either side we have 12 pairs of ribs, right? So now our question is intercostal space. So intercostal space, what is intercostal space? Now the space which is present between two ribs is actually intercostal space. Okay. When you see the intercostal space from outside, the first muscle what we see is this one, external intercostal. Once you remove the external, we have internal, then innermost. Then below this you will have neurovascular plane, van structures. VAN, van. That means we have intercostal vein, intercostal artery, and intercostal nerve. Three structures we will see. So intercostal space, it is the space between two ribs. Since there are 12 ribs on each side, how many spaces will be there? 11 intercostal space. So in each space, we will see intercostal muscles, we will see intercostal neurovascular bundle, we will also see lymphatics. Okay. Now when we come to the intercostal muscles, so we have three muscles. Now you can see this is rib above and then we have rib below. This is the first muscle you are seeing there, that is external.